Brantford is now among the Ontario cities with COVID testing in pharmacies. The tests are free, but only for those with a valid reason who don't have symptoms. You have to make an appointment and wait for a lab to determine a COVID diagnosis. That should soon change. Health Canada has granted the necessary approvals, one day after Canada's procurement minister announced an agreement for almost 8 million COVID tests that can be done with a nasal swab in a pharmacy or doctor's office, with quick results. The news came at the same time the Premier was holding a news conference, so far unaware and still railing at the delay.
Just imagine that, being able to go to a pharmacy, getting the test, waiting outside, coming back in 15 minutes, and you have your results.
Shortly afterwards, in a statement, Doug Ford said the new test is a great first step, and he expects delivery as soon as possible so people can start using them. He also called for more kinds of tests already approved in other jurisdictions. COVID projections for the fall show Ontario is on track to record 1,000 new cases a day by mid-October.
Anything that we do now to reinforce the point to control the transmission of the disease will start to have an effect days later. And so there is no sort of ability to turn a switch or dial up and down on what's going on.
As the curve started upward, Ontario lowered the number of people allowed at private gatherings. That was September 19th. Then on September 25th, new rules that limited bar hours and banned strip clubs came into play. If those new measures are effective, they won't be reflected in the data for a few more days. The key trends are that infection is rising in all age groups and that the percentage of tests that come back positive is growing.
What this means is that although we see a large amount of infection among younger people right now, this is likely starting to spill over into older age groups, which is where we see the most tragic and most challenging consequences for health and for the healthcare system.
The trajectory in cases means hospitals have to prepare for strained intensive care units.
So we are right now at low, but that's because the ICU is the last measure other than deaths for us to change. As we see those cases changing early, we start to get very worried that the ICU use will change in a few more days.
So far, there is no plan to shut down schools or businesses. Public Health says the current spread began when people relaxed the rules around social distancing in the summer, and that if people resume vigilance around wearing masks, keeping apart, and sanitizing hands, the curve will flatten again. Lisa Hepfner, CHCH News.